Well, I'm a physical therapist in Brazil. I graduated 20 years ago, 19 and a half. And since then, I work with the treatment of pain. So everybody that has shoulder pain, neck pain, low back pain, adherence, limit of range of motion, that's my job. That's my passion. And 4 years ago, no, 10 years ago, I started to travel to teach all the techniques that I do on my clinic. So the full formation of dry needling, chiropract, basically on the spine, the instrumental assisted to soft tissue manipulation, and many other things to help us to guide how it's important for us to know anatomy and apply with good quality of techniques. Because today, the market, you can take any course you want, but sometimes you learn how to do the technique and not why to do the technique. For example, to get a needle and punction on a trigger point, it's easy. You can learn on YouTube. It's easy. But why, when, how, that's the main clinical reasoning. That's the main thing that I'm trying to teach on every course, on every weekend that I travel the whole simple year. So on 1 year, I make around 160 flights. That's a whole lot. Traveling, teaching, being in conference, and everything gonna be all right to be in India in December. I'm hoping for that.
That's great, sir. That's great. And we are hoping that when you come to India, most of our viewers and the students from physical therapy and professionals attend your workshop.
Yeah, that's gonna be very nice, very nice.
Sure. So, sir, can we start with the topic, the new IASTM concept?
Yeah, let me get one thing. Well, I think everybody knows about these 5 letters IASTM concept. This is my concept that I'm going to introduce you in a few minutes and tell about the difference between. First of all, what we have to know the difference is instrumental assisted soft tissue mobilization. If I use a hook to release a tendon, this is a kind of IASTM. If I use a trigger point release to press a trigger point, this is one kind of IASTM, okay? If I use a stainless steel, and this one is a colorful one, it's very nice, made a friend of mine from Pakistan, close to you guys, Hamid, a very nice company that if you need, he can produce this kind of colorful stainless steel. So if I do scraping technique, this is a kind of IASTM also. And for example, cupping technique, it's also an IASTM technique. What I wanted 4 years ago was something to create a copy of the hand. So on my mind, the stainless steel is too hard to do deep techniques. So I was asking myself, what can I use to make something compared to manual therapy? Because we as a physical therapist, we use a whole lot of our hands. And maybe in 40, 50 years, we might have disease, arthrosis, arthritis on the fingers, and we won't be able to work anymore. So this was bothering my heart. So what I did, it was to look for in the market one kind of material that could have the same density as the human body. And the bone has a number, 1.2 grams per centimeters of density, okay? But the stainless steel has 8 grams per centimeters, so it's much denser. So if you are not careful to do a bone technique or close to some regions that can be painful, it's going to be harmful. Okay, but to scrape is very nice. So the second thing was I had the polyethylene. That's a kind of super plastic. The same as to fight, use the stick. the bumper of the car, and so forth. So this is one polyethylene. It's hard, but if I do a whole lot of stress, I can bend it, and then it goes back. It's simple, it's there, straight. So it's a super plastic. So that's why I chose polyethylene, because the density is 0.96. It's even less than the human body. So if I hit, and if I hit, it's the same thing. So that was my first point. The second point, the thickness of the tool. So I have on the set, I have 4 tools, okay? That's the whole set. And what I did was 2 tools using 8 millimeters, because the side of the thumb has an area of contact of 8 millimeters. You got it? You are following? And I did 2 tools in 5 millimeters, because the tip of the finger, the average of the area of contact is 5 millimeters. So I have a long in 8, a long in 5, a squared in 5, and a squared in 8. So I have the combination, because sometimes I have to use my hand or my forearm. And now the shape, the third pillar of the tools, I had to answer what kind of shape, because I have to have a shape that can copy my hand, my forearm, and my elbow. For example, this simple tool is right as a copy of my forearm. So to try to treat the hip, to the low back, the shoulder, when I have to slide my forearm, I can use this kind of finger. This kind of tool, for example, I have my thumb right here. It's a copy right there. And for example, here, another copy right here. Or the side of the hand, the side of the hand. You see, it's about the same thing. Or the arch of the hand. And on 5 millimeters long, 5 millimeters short, square, the same thing. Side of the thumb, the arch of the hand, the side of the hand. So anything you can do, it's on the tool. And the last one, the square one, this is a main important one. Here is about as my elbow, the olecranon, okay? So I don't have to press my elbow anymore on someone, because it's ugly to see. It's kind of strong, too much painful. And I have the tip of my thumb right here or right there on a closed angle or more open angle. So from now on, it's physics. If you need, for example, on a hand fascial problem, if you want to do with your hand, you're going to slide deep for 5-10 minutes. But sometimes your finger cannot hold that pressure. So now I can use, I just look to the tools and I ask, where is my thumb right here? So it's right here. I can come and press and slide. And now I have only to hold the tool and do that thing. So basically now what I'm trying to tell the world, and I developed this 4 years ago as an official pattern, and I've been traveling to around 7 to 8 countries, and India in December going to be the 9th one, and from there we're going to start a new project with you guys once or maybe twice a year to teach that. Jatin Patel, it's a great physical therapy that you might know. He came to Brazil in January to take the course with me. And so we're organizing this whole situation to teach now for everybody. So what is this? It's another concept that copies with your hand. That's why I call mechanical physiological concept, because I have the mechanic of the tool doing exactly the manual therapy does on the physiological movements for fascia, soft tissue as muscle, and so forth. Okay, that's the main idea.
So, sir, what all topics will you cover when you come to India about for that workshop?
I'm going in December for 3 courses. That's the good part. I'm going to teach 3 courses, 2 days each. So this full formation to learn the whole body, and I have, for example, head, spine, shoulder, hip, a calf, feet, and so forth. Another 2 days with spine manipulation using chiropractic techniques. It's a very nice course to treat spine pain and learn how to do safely. It's not getting the head and rotating, nothing like that. And the third one, the full formation in dry needling. So dry needling is not only to needle the trigger point, it's more than that. For example, we have intra-articular techniques and apply electric stimulation, which is very nice to treat acute pain. We have also, for example, we can needle underneath tendons with 3 or 4 needles and do passive movements to treat adherence. We can treat scars very nicely and gently. So that's the third course. So I'm going to stay, I think I will arrive in Surat around December the 10th. Okay, December the 10th. And from there, I'm going to stay 6 days straight to teach the 3 courses. And then I have to come back to Brazil to teach another course around here. If you guys want to receive the video of the course, I'm writing down right now my phone number from my WhatsApp, so you can ask, hello, Gustavo, can you send some contacts, some videos about your techniques? I have many things to send to you. And soon, when I have the official video for the course, I can send through
I
you
have pinned
guys.
the number.
It's
I've
right
pinned
there.
your
Oh,
contact
it's
number
fixed.
over there.
Okay,
Yeah.
perfect.
So
just
anyone who
my
wants to contact, get details from sir, you can contact him on his number over here.
Got it back?
Yes, sir.
Got it? So,
Yes, sir.
how far is your city to Surat?
My city is around 4 hours far from
Okay.
Surat, 4 to 5 hours.
Driving?
Driving, yeah,
Drive.
by
Okay.
road.
It's not that far, but it's possible to get there.
Yes, but viewers are, many of them are from Surat, Gujarat. There are many viewers from Gujarat and Surat.
That's
And
nice. And another thing that I want to tell you guys is, I know that the stainless steel is very popular around the world. The scientific base, we have now basically 2 ways to use the scraper. If you scrape, you are increasing the heat. It's getting more heat, okay? And this is going to do a effect called thixotropism, okay? Thixotropism. So you get increase of heat to release superficial fascia. For example, let me show you guys some videos in my computer, okay? These are videos from the course that we're gonna be in December. I have, for example, let me show you one situation right here. For example, if you try to analyze this situation. Okay, hold on. Okay, can you see that I can pinch the skin very nice? It's easy to move the skin, okay? So this is soft, this is release, this is nice. But if you're getting improving ahead, I can still pinch, but when I move downwards, it's not that easy, but upwards, it's much better. Maybe you can feel through your eyes. Now it's harder, something stuck here. So this is superficial adherence. This one, I can still pinch, Downwards, it's not that good. Upwards, is not that good, but I have a beginning of the adherence. Check this out. Now I have a difficult. Okay, now I have a difficult to pinch the skin. It's a second stage. And the final one, for example, now this one, look, it's even worse. I cannot do nothing. So is one kind of fascia? Yes, it's one kind of fascia. But if you ask, let me show another kind of fascia, I have this kind of fascia. This kind of fascia now, I can slide from the frontal occipital muscle, the paravertebral muscle, the hips muscles, the ischiotibialis muscle, the calf, and the muscles deep on the foot. And I have also this fascia that you can slide on this muscle chain. If I do, for example, the iliotibial band, okay, it's one part, it's only one part of this whole fascia. So this now, let me show it right here. One thing, it's when I try to pinch like this, I have vertical connective tissue. But the second kind is when I try to slide the fascia. So when I do myofascial release, check this out. When I do myofascial release, what kind of fascia I'm talking about? Let me show you guys this video. That's one of the research that I'm doing in Brazil. Very nice. The fascia before, this is the low back region area, okay? The paravertebral muscle, the skin, the deep fascia. It's not superficial fascia. This is before. And 2 minutes later, sliding and oscillating. Check the deep layer, how can move much better compared to this one. And the video, the technique, for example, for you guys to check, this is in Portuguese, but the posterior fascia, doing soft tissue manipulation, okay? So what I have here is I'm going to use one tool that has the same kind of the hand to do a technique that the manual therapy does. So soft tissue manipulation on the posterior fascia. This is before what you guys just saw. And you're gonna see one part, a little bit of the technique. This is low back, but I'm going on the thoracic part to do a oscillating technique on this fascia chain, on this fascia line. I'm oscillating on the lab and my friend recording, and that's the movie, the film, the after. So the first question is, if I scrape in one part, am I releasing the whole fascia line? Maybe not. So what we have to have straight in our minds is, what kind of fascia are we talking about? After that, if you want to scrape, this is perfect. If you want to do with the manual therapy concept, instrumental manual therapy concept, it's okay. If you need to use a technique for gua sha, this is a gift from my friend Jatin Patel, so say hi to him for me. And you can scrape also to do gua sha. And if you want to release side by side the soft tissue connection, you can use a hook that I'm going to teach that you. It's simple, it's nice, it's comfortable. So that's the main thing. What kind of soft tissue are you talking about to understand what you have to do? Okay?
Right. So, sir, just now what you showed was given to you by Jatin, sir, right? Was a gift to you?
Yeah. Jatin, he gave, when he came to Brazil, he gave this one and this one. That's a gift from him. I have this one smaller that I always have in my purse, my backpack to show the students, and I have this big one.
Right, sir.
So
sir, so according to the area, the larger area and smaller area, so we have to decide which instrument to be used, right?
yeah. Now actually the course, I have to teach everything, the full formation. So whenever you need one thing, you have a tool for that thing. Whenever you have a need, you're gonna have a tool for that need. That's the main thing. For example, if I have to press something, I can use my finger. If I want to screw something, I have a special tool. It's basically special tools for different use. And one problem that I see in the whole world is that everybody wants to learn techniques. Technique for this, technique for that. But if we start thinking about when to use and why to use, the technique is simple. For example, a stretch is very simple, but sometimes we cannot do that. We cannot do that, okay? A friend is
So there is
asking
a
me,
question, sir.
what?
How can we access fascia before applying IASTM technique?
Well, it's a very nice question, Evangeline. It's a very nice question. Deep fascia, we cannot, because we should put too much pressure, it would be uncomfortable. But for example, if you have a person standing up and try to touch the floor, okay, bending forward. If a person doesn't have a good stretching technique or flexibility, most of people, it's going to stretch this person, and she's not going to get better. Sooner, she's going to be shortened again. So this is one kind of signal that we evaluate during the course and during physical therapy program to understand that it might be this kind of fascia that slide the whole muscle chain, the posterior one, to try to release this fascia. For example, I can have a person that try to reach the hand on the back and then the other hand. Suppose that one hand is until here and the other hand is until there. It might be a joint problem or a capsule problem. So we have to test. So we have ways to test the flexibility of muscle, sliding concept of this kind of fascia, and muscle test, and also joint test. So basically, to answer you, we have to test and we have different ways to do that.
So, sir, how do we assess that the fascia is adhesive, or how do we do the assessment part?
Repeat, please.
How do we assess the fascia? Like how do we come to know that the fascia is adhesive?
Okay.
Yeah.
Well, first, always evaluate before, after. Movement, the pattern of movement, range of motion might be a muscle problem, it might be fascia problem. So you try to stretch the muscle. If it's stretching, so it not be a limit of range of motion because of the muscle. So it might be fascia. For example, I can put my hand on something. For example, let me show you how, guys, here. I can put my hand on something and I can rotate to stretch the major pectoralis, okay? It's a simple technique. So I'm going to hold right here, hold on. I'm going to hold there and I'm going to stretch, okay? I'm stretching the major pectoralis. But if I do this tip, pay attention. I'm rotating, but now I press deep and I stretch to the opposite side. This is a fascia concept because you're making pressure deeper and stretching from deep layers. So that's the clinical reason. It's not only a simple technique, it's knowing anatomy. So that's the main thing for that.
So, sir, what are the contraindications for IASTM?
One contraindication, if your skin is damaged. That's it. Or if a scraping technique was used too strong and it's sore on the second day. After that, no, there is no contraindication. You have just to be careful. For example, do not use too much strength, okay? Do not use when you don't need to use. It's like a shot. You have one shot, two shots. So try to do more specific. So clinical reasoning and how to use and why to use. But contraindication, the quality of the skin is the main thing, okay?
So why do mostly bodybuilders and athletes prefer IASTM these days?
They do the technique. Why they do?
They, yeah, they prefer more IASTM, like bodybuilders and athletes. They go for IASTM mostly.
They
So
sting
why
like
is
steel.
that so?
They sting like steel one.
Yeah, they want IASTM on their body, like to mobilize their soft tissues.
First, because they feel good. That's one main thing. And they do feel good. Second, because they feel difference. And everything that they can believe, they can improve, it's good. We have to do that. Sometimes stainless steel scraping technique can be harmful on bone areas, okay? And using a material that maybe is more compatible to your body, it's simple. For example, I can do a release on masseter, okay? Sliding technique. I can use this part on the digastric. I can press, I can put, and slide. And the stainless steel would be very harmful for that. So they
So, sir,
do
there is a
because they
question.
feel result.
There is a question for you. How can we decide how much pressure is needed?
How much pressure? We are trying to research that here. Basically, if a person is too strong, you have to press more. If a person is too skinny, you have to press less. But you have to know anatomy. Anatomy is the basic thing for everything. So you know that you want to achieve a deeper fascia. So you're going to have to press more. But on a skinny person, it might be a problem. So you have to try to figure it out how much you can without hurting anyone. Okay? That's the main thing. Second one, you do the technique, supposing your pressure was okay. Okay, I pressed really hard, was comfortable for my patient, and now the major thing, retest if you got result. If you got result but not enough, repeat, retest. And if you got the whole result, that's it. You achieve your goal. So that's the main thing you have to do. Okay?
So, sir, there is one more question. Can pain variation type pattern help us to differentiate MSK and fascia?
Variation type. Yes, I just answered 10 minutes before. Yes, we can. You have to do tests for muscle, stretching. Then you have to test fascia, doing a sliding technique that we can do that inside of the physical therapy program. And the type of technique is going to be done through what you evaluated on the evaluation. So you evaluate, you find out what you need, you do the specific technique, you retest, and then you see the result. If the result is 50%, let's say that, you do that again, you get more result, and you retest. If you got 95%, okay, very good. You just keep moving to another kind of technique, okay?